So Marvelous is currently employed by ViiV Healthcare Canada as the Community Relations Manager. She's also a Ph.D. candidate at the Factor-Inwentash Faculty of Social Work at the University of Toronto, where she will continue to develop and focus her work in social work and global health, which she's done for over the past 24 years. Marvelous has filled a number of different roles, both frontline and administratively in the not-for-profit and NGO sector. Marvelous, I think, spent a number of years of her career here in Canada working at Women's Health in Women's Hands, which is a community center in downtown Toronto that specializes in health promotion, program development, case management, and outreach to women and ethnically based or culturally diverse communities. As an affirming woman with lived experience related to HIV, Marv has made it her mission to spread love and empowerment. She's a writer. I've had the privilege of working on a book chapter that we've had the chance to write and revise together. She's a motivational speaker. She's an advocate for marginalized communities. She sits on board. She does amazing things. But I want to say the most important thing for me is that when you sit in a room with Marvelous and you have the opportunity to hear their words you never forget. And I have this vivid memory of the first time I was in a room with you, Marvelous, at 790 Bay Street, such a long time ago, where you talked about your experience, and you were so powerful that it's no surprise to me that in the 13 years since then, your career has just exploded, and you're now in this, really amazing place where you're doing such important work. So Marvelous was asked to come here today to talk to us about one question. And our question is intentionally vague. And we said, take it wherever you want. And the question is, now that you are in a position as a leader in the field of women and HIV research in Canada, what is one thing you want to share with the future of women and HIV researchers in this country? So I'm going to mute myself. I'm going to shut my picture off again so I can keep eating. And I can't wait to hear from you.
Thank you. Thank you for such a superb introduction, and you can go back to your eating. So I closed your video. But I feel like I'm home with you guys. But before I go and share the one thing, I just thought it would be amiss if I leave this call without mentioning how I got involved in research and where it started and how it has progressed. I still remember when I came, one of the first people that I met at the conference in the first weeks I came was also Mona and Wangari and Notisha, and we're talking about the work I did in Africa and how it differs from the work that is here. And for some who've practiced in Africa before, I think it resonates with you all that the boundaries that I was facing when trying to do work here was something that I was not used to. I was used to working in an environment where those boundaries are maybe you don't even see the differences. I used to work in Africa first as a national finance secretary in charge of financing projects in the 10 provinces of Zimbabwe. But that progressed to me being advocating and working with UNIFEM and UNAIDS on women and gender budgeting. That's how I moved away from my finance role. But when I came here, I quickly saw that as much as you want to maintain that authenticity of who you are, there were things that I needed to take into consideration, like conflict of interest, boundaries. Back home, I could go to people's houses. I could take a patient to my house and they would sleep over. I would fight with the family if they were stigmatizing. And I didn't care what happened. There were no implications about thinking about legal, thinking about who's suing who. But of course, not saying that in Africa that is not there, but we have structures in place where people were supported. We worked with the human rights closely, and so I came as a true advocate, like ready to fight, beating pots in the street and drums. That was the advocacy that I was used to. I wasn't used to that deep, polite, and diplomatic I had to learn that when I came here. But I still remember Lana James and Carmen Logi were on this research project that are working with Mona, and it was looking at research needs for women living with HIV. And if I'm not mistaken, instead of getting the results of identifying what are the research needs that women wanted, it came out with so many other priorities. And that was my first time coming also on the table, on the advisory committee table, and seeing how flexible Mona, and I'm not beating her drum. She knows if she had done some bullshit, I would say it too. But but I was glad that it changed the diverse. That was not the priority of the research, but women actually called out for what they wanted, and what they wanted was what was made into a priority. And I think there was also how the fertility study came out of all those discussions. And as a woman who had also experienced tubal ligation in Zimbabwe, like tubal ligation, I mean, I couldn't give birth normally like other people. I had my tubes cut because I was HIV positive, and someone felt like I didn't have the right to continue breeding, and I didn't have a right as a woman living with HIV to continue also thinking about having a family. So that's what brought my passion into the work and wanting to be involved. Another example is the infant feeding. I used to have conversations with Mona, and I was telling Mona, you know, women breastfeed. Mona was saying, no, my women don't breastfeed. Therefore, they always come and tell me they don't breastfeed. I said, no, women are breastfeeding because they're coming from countries where they're told they can exclusively breastfeed. And now they're coming in a country where there's good resources, there's clean water, and they're told they cannot breastfeed. Again, Mona and her team. I'm just saying her team because there were so many players there were so many researchers who came into play. We had a community forum where we discussed openly about breastfeeding. Now we're talking about guidelines on breastfeeding. So why am I giving these examples? I'm giving these examples that I was a poor immigrant from the South. I came, but I didn't want to have my light put under the table. I still wanted to shine, but I had to find out who are the strategic players. I had to run with the with the boys and the girls for me to be where I wanted. So I didn't get to this position just because. I also remember when I applied for my job at ViiV, I went to Mona. I said, Mona, I know you work in Saskatchewan. How would you answer some of these questions that I've been given? So it's all about knocking the right doors and being humble and knowing that you cannot do it alone. There's expertise. There's so much great expertise out there. There even some people that I'm not saying only people who are in positions of power, who are physicians, are the only ones that will help you. In my position now, there's so many times I knock on community people. I do site visits. I go across Canada. I don't miss meeting a woman living with HIV for lunch or for dinner, because that's where I get the gist of what's happening in the community. Because an organization can tell me, oh, things are working well, we've seen 100 people, but the people who are on the ground will tell you the truth. So, so for me, it's all about, it takes a village. We always say it takes a village for us to build something. So there's no one who has less power than others. When we are on the table, we all have the same power. So don't feel like, I don't know, I'm new in the country. I used to bring things that we used to do in Africa and say, okay, how can we use it here? How can we actually enhance what we did in Africa? How can we enhance what we did in the Caribbean? How can we enhance what we did in so many other different countries? Because we're a diverse country. So I also, what I do is I wear different hats, but on each table that I go, I make sure that I bring along my indigenous sisters. I bring along my LGBT community. If I don't know, before I get to that table, I give a call to someone who has the expertise. I've never been in prison, but if I'm asked to come and present about criminalization, I someone else, or else I pull them to go with me and do that presentation. So that's how I got involved research. I got in by force, by hook or crook. I wanted to be there. But what's changed, I made sure also that sometimes when I was sitting on those tables, I didn't understand half of the things that they were talking about. Some of the things were too public health for me or too social work for me. So I went back, I made it a mandate. I still remember there was a meeting in a public health meeting that was held in Ottawa. And me and Trevor from Pasan attended that meeting. And I can't remember who else was there. I raised up my hand to mention a point, a contribution of what I was seeing on the guidelines of HIV testing, what was not working. And no one applauded or cheered. You know, when you say something, people cheer, and no one said cheered. But when we went to breakout sessions, when we came back, we were supposed to do a task. The very thought that I had said, someone presented it from public health, and they presented as if it was their group discussion, but they were right in presenting it using the right language. They presented the right public health language. They were talking about epidemiology. They were talking about, but it was the same idea that I had said. But the difference was because the people that were in the room attended, appreciated this language, it was taken as if it was greater than what I had said. So I told myself, I still remember I told them when I was leaving that day, I said, watch me, I'll come back with my PhD and I'll be able to talk that language with you. And I've gone back to school. I went to do my diploma in social work. I went to do my bachelor's in social work. I did my master's in global health. And now I'm going to my 4th year in my PhD. But that's not the path for everyone. Some of you are not bookworms like me, or might not have the pleasure to have the time to do all these things. I don't have a child, I don't have a husband, so I can do anything that I want at any time. So in whatever capacity you have, you can do it. You'll be able to get it different. Wherever you want to go, find ways of how you can get there. So now, going to the ask question that I've been asked. And you know, when you ask an African woman to tell you something, don't expect them to just give you the answer. We go a long way. We'll go to the market, we'll go to the borehole, we'll go everywhere before we go exactly where we are supposed to be going. So thank you for accommodating that. So for me, the question, one thing I want to emphasize to all future women leaders in the field of women and HIV research is the importance of intersectionality. And I'm going to break down what I mean by intersectionality, because I know maybe some of us are not social workers, or some of us have never come across that word. So intersectionality is a term that was first talked about by a legal scholar who was called Kimberly Crenshaw, who realized that you can't just talk of a woman as an individual entity. A woman has got other identities which are based on race, on gender, on immigration status. There's so many things that inform who we are. I'm marvelous here, but I wear different hats. I have different, you might think I'm heterosexual, but that's an assumption. You don't know what other things I do at night. You don't know other things that I do. So don't assume when you see someone that this is who they are. So that's when we bring in the term intersectionality. But also, intersectionality looks also, how do we as women interact with the systems of oppression? How do we interact with the structures that, with power, with how men see us, or where men want to see us, or where systems of power want to place us? That's the intersectionality. So why am I bringing intersectionality in research? It is important because it should inform your research before you even start thinking about your research. You should be thinking about, okay, the population that I'm bringing, what is it that about them that I want to know about? But why am I even doing the research? Don't just do the research for the sake of the research. We also did a video with Mona and Carmen and Wangari where we're saying research should not sit on the shelf. So when you do that research, what are you going to do with the information? So some of the key points about intersectionality are that people with multiple marginalized identities can be left out of important discussions and policies. We rightfully know that when decisions are made, they're made sometimes at a higher table, or when researchers come with topics, sometimes we are brought in at the end of the already the questions have been developed already, everything else has been done, how people are going to be recruited, and people just want to tick a box to say, oh, we've included a black person, there were 2 3 black people, or there were 3 4 people from the LGBTQ community, or there was an indigenous community. No, we are saying, don't leave out people, include them from the beginning. When you come out with an idea, get their perspectives on what they think about the topic. There is also power imbalances that play a role in how individuals are treated. So when you come there on the table, do you feel like you're empowered enough to raise your point or your hand and raise something? Also, for those that are seasoned in research, are you taking consideration that when you're sitting on the table, you've seen some people contributing, but one of the person is not contributing? Are you also trying to, not in a stigmatizing way, but how are you bringing them in the conversation? Because there must be a reason why you brought them on the table. So make them welcome, make them feel comfortable to contribute, because no contribution is lesser than. Every contribution, even if it comes looking like lesser than, you, the educated ones, can turn it into a good point, but you have to acknowledge the person who contributed. Don't just run with the idea and leave them behind. Discrimination can be based also on multiple inter identities. So be mindful of the language that you use when people are on tables, when you're doing our research, when you're doing the questionnaire. You might make other people feel. I did a presentation, which Logan and Mona and others also witnessed when I was at the international workshop for women in HIV. When we're talking about language, like how we have to change some words, like we are not victims of HIV, we actually survive. Even the word survivors, I don't like it in some cases. We are more than just people living with HIV. So what is the language that you're using when you're in that room, when you're discussing about the research? Is it an empowering language, or is it a language that will still make me feel living, knowing that I'm not par with the people that I'm sitting with at the table? There's systems of oppression that also exist. We know for sure, if you're a new researcher, you can't be the lead researcher. We know there's certain structures that we cannot change overnight, but we've seen changes in so many things. We've seen Chios, for example, have put in authorship, how people are recognized for their contribution. I was actually doing updating my resume, and I was putting research that I've participated in. It was so funny that when you put the or an article, if you pull an article from Chios, the list is endless. There's so many people there on the authorship. And I've also been called upon, even at the global level, or on the with ViiV, where people have asked me for feedback to say, how do we work with community? I've always run back to say, there's Chios. Go to the Chios website. You'll find they have guidelines on how you include people and authors. So we that involving, it didn't just come from the intelligence of Mona and a few others. It was a collaborative process where people living HIV would challenge also to say, we want to be this, I want to do this, and they were accommodated. So hopefully, when you do your research in the future, you are also going to actually involve other people. And we also have complex identities and issues. When you involve marginalized people, you might have to be mindful of also there's so much to invest in. You need childcare, you need to accommodate the chronic illnesses. So some people might miss meetings. How do you follow up with them to keep them updated so that they continue to be involved? But what investments, before we even submit those applications, are we including the honorariums that is reasonable for the people that are participating in research, both the people we are recruiting, but also people who are involved? Also, are we investing in the knowledge translation of the research that we are doing? Let it be something that can be replicated in other settings. So in summary, I can say the practical steps for future leaders will be to incorporate intersectionality in research design, ensuring that your research questions, methodologies, and analysis take into account the intersectional identities of women you are actually studying. And when you talk about intersectionalist and methodologies, I talked a while ago about being narrative. Some communities are very narrative. Some communities want to use indigenous methods. Some people want to use. So you have to think of the population you are working in. What is it that they like? Are they gay men? Are they? Who are they? Because just choose something, a method that are we going to be doing it in a place where people are dancing? Where? Let's move away from the norm. Let's think outside of the box so that how are we including heterosexual men? Because women, we don't have sex on our own. We have to think of also the other significant partners that are in our lives who do not come in the HIV sector. How are we involving them? Amplify Amplifying marginalized voices. Seek out and amplify the voices of women from marginalized communities, including indigenous, black women, trans women, sex workers, and women living in poverty. When you do the research, how are you changing the language of public health? I still remember one also significant point where women and also people from the black community fought with uh, the late, I've forgotten his name. He was a researcher, the late one. He presented a research that was looking at the risk factors of ICB population. Just the way it was the right data, right information, but it's the wrong word. It made and people revolted. I'm telling you, they revolted because it made black people look like they want Robert Remis. Yes, Robert Remis. And Wangari was sitting on that table, and people were asking Wangari, how could you let this pass? So sometimes we sit on these tables, but it's not because we're letting things pass, but it's because we are also used to that language being used. That a language can be said and you don't see how wrong it is. And it's okay when it's raised for you not to react negatively, but to acknowledge that you made a mistake. And that mistake was acknowledged. A community forum was called upon where Robert Remis, Wangari, and everyone who was involved in that research was called upon to right the wrongs. And I've never seen it done again. A few here and there is still being done on language. So acknowledging our mistakes is also important. Mentor and support other women researchers. Mentorship can be different. It's not everyone who wants to be loud and proud and out there. Some people can be silent contributors, but let's recognize, and some people are not able to recognize their own strength, be able to ignite their strength, because we've faced so much trauma in our life that we've just given hope. And sometimes us as women, we are our own enemies. We don't support each other. We don't raise each other. We only do backstab each other. Let's stop that. Let's support each other. If someone is doing something wrong, take them aside and tell them, no, this is not right. Let's do this. But also remember, we are at different levels. Intersectionality, again, we are at different levels. Some have power, and Shakespeare said it rightfully. He says some are born great, some achieve greatness, some have greatness thrust upon them. So all of us have got different levels where our power is coming. So lastly, advocates for policy change. We need to see policy changes within our organizations, policy changes in research, policy changes in academia or wherever we sit. Let's have policy changes. Let's have diverse people participating. So with that said, that's my contribution to my one thought. And lastly, and I mean lastly, for those new researchers and women living with HIV who are also in the hub, please dare to dream big. Don't let anyone stop your dreams. Continue dreaming, you'll get there. Embrace your power. You have power, sweetheart. You have power, especially wearing the HIV pet. I've used my HIV card on different tables. I'm not saying that's the only card, but I know it works. So use it, and use it in school, use it everywhere, use it. You have the right to use it, and don't even feel shy. Break barriers, believe in yourself, and stand tall. Don't let anyone make you feel like you don't belong. If I belonged in pharma as a Black woman and someone who didn't have even scientific background, you can do it. And empower others. Even if you hear of something, tell others. You know, she is recruiting. Oh, just encourage them and believe, achieve, and succeed. Rise up, my sisters. Thank you.
Thank you so much, Marvelous. That was amazing. Thank you for your insight, and you're definitely an inspiration for a lot of people, especially PHAs. Keep doing the amazing work you're doing.